Klaba, thanks for your time. You've been to court and you did not win there in trying to force that your members be protected or be issued with protective personal equipment. My question to you is, what's your next step in ensuring that your members do gain access to the much-needed PPE?
Well, in relation to that, we subsequently had a meeting with the minister, and we were assured that PPEs are being ordered and that there's enough stock for our members. And of course, the donations continue to pour in. We saw yesterday there was more donations from soccer teams as well. So we'll check on a daily basis whether the PPEs are adequate and we have the right specification and the right amount that also corresponds with the headcount. So it's an ongoing process. We're not going to take these matters lying down. We will ensure or do everything in our power to ensure that our members are protected.
Yeah, Kaya, the issue around protective gear may not necessarily be a problem that these workers are faced with. How well trained are they in the hospitals that they work in? Do they know the safety precautions? Because you might find that the management of the hospital has done its best to train them on the protocols, but some of them are simply not following.
Look, we're worried with the issue of training, which we raised very sharply with the minister last week, that this is a new disease that we are dealing with, and it's important that people are trained on how to deal with it and the best practices in dealing with the virus. Then I think even the basics are lacking in that workers would have to be taught on how to deal with, to use the mask and the gloves. Because remember, when you use the mask, you can't touch it on the outside. There's a specific way how to put it in and take it out. Also the gloves as well, and that you can't touch them on the outside. Those are training that should have taken place extensively, and I don't think that has been done, especially in the private healthcare sector. In the shop steward that we've encountered or that we have spoken to, that training has not taken place. So it's important that if we are to contribute in the broader fight to flatten the curve in stopping new infections, that training takes place immediately, and that it's an ongoing process to ensure that workers really grasp how to protect themselves, but to ensure that these hospitals have adequate supplies of PPEs and the right specifications in order to protect our members. Because what is happening now in the private hospitals, it's really not acceptable, in that we are losing healthcare workers already being understaffed in the healthcare sector in the country, and we're losing beds. So as and when people will need to be hospitalized, then we won't have enough beds because hospitals are closing down due to the negligence of the big four hospitals.
Yeah. Very briefly, Kaya, on this matter, there's another one I need to explore. The two Netcare facilities in KZN. You have Kingsway now that has come onto the picture after the St. Augustine's matter. What do you think the problem is exactly there?
I think that the problem is an issue of negligence and being reckless by the management, in that we think their sole focus is on profits and their standing in the JSE. So they're not really focusing on their core business, which is to treat people. For instance, what happened at St. Augustine was that workers were not told that their patients who were infected with the virus. Hence, workers, from what we gathered, did not use the PPEs because they thought they're treating normal patients. So then things got out of hand. So the management did not take it upon themselves to inform workers so that workers know what they are dealing with. So because they were focusing on other things and not their core business. And then when we asked them for answers, they've been evasive. The same as Kingsway, they can't really tell you the number because they're trying to protect their image. So for them, it's about damage control and not really putting measures in place to ensure that such occurrences do not occur again. So we're very worried, and we're calling on the minister to use high-handedness on these private healthcare facilities, because they are really dropping the ball, and they've become the weekend list in dealing with this virus.
Very briefly then, Mr. Klaba, on the issue of the multi-year salary agreement that you say government has reneged on, what's your next step there? Because you're saying your members are furious.
Well, our members, furious doesn't even begin to explain it. Our members are very infuriated that government has not paid their salary, their increase, which was supposed to kick in yesterday. So it comes at a very bad time when workers are supposed to be in the front line of dealing with this virus. So we'll do everything in our power to ensure that government sticks to the agreement, because it's a binding agreement that was signed by both parties. So for now, we've written to the bargaining council for the matter to sit down for conciliation. So we want you to sit as soon as possible so that these matters can be resolved, because this does not bode well for the morale of our workers, because they are doing everything under very horrible conditions, sometimes life-threatening, while government doesn't seem to notice their hard work. Instead, they kick our workers in the teeth.
All right. Thank you very much for your time. Kaya Klaba speaks for the public sector union, Nehawu.